Many faculty and staff ask how to respond to a student mental health crisis. This training will provide guidance for that situation. This subject can be hard to think about as it includes topics about suicide, homicide, and other life-threatening situations. Take a moment to check in with yourself and only watch this video when you can think about such difficult situations. Throughout your interactions with students, you may encounter a student in a mental health crisis. For this situation, it's helpful if you've had some training in how to respond and if you've anticipated your reactions. So let's do that. Your first step in this situation is to assess its seriousness and urgency. A student may be emotionally distressed, but this may not constitute a crisis. Mental health professionals and emergency responders define a crisis as a situation that involves a threat to someone's immediate health, safety, or well-being. You can most directly assess the seriousness of a situation by asking the student if they plan to hurt themselves or someone else. For example, a student may be discussing having no hope for the future, or they may be talking about hating someone and wanting them dead. You can ask, "Do you have plans to end your life?" Or, "Have you been thinking about causing physical harm to this person?" People tend to respond honestly to these questions, although you might think they won't. And if they're not planning harm, asking won't plant the seed, although it's a common worry. Thus, you should ask directly. Other ways of assessing the seriousness and urgency of the situation is to ask whether they thought of how they'd harm themselves or the other, if they have access to this means, for example, a nearby bridge, a firearm, or pills, if they've attempted it in the past, and if they plan to take action soon. A yes to any of these questions increases the seriousness and/or imminence of the situation. When assessing the imminence of a suicide attempt, we're finding that some students are thinking about suicide on a somewhat regular basis, but aren't currently planning to attempt it. For example, if a student says, "Yes, I've thought about killing myself, but I simply wouldn't do that to my family," then you can assess their situation as not a crisis. In other words, a student thinking about suicide doesn't automatically make the situation a crisis. For a more thorough discussion of how to respond to suicidality, participate in the online asynchronous mental health training module, Student Mental Health on Your Campus. Then, the Situations of Student Suicidality module that takes about 20 minutes. If after talking to a student, you're not sure how serious or imminent the situation is, consult with someone else. Contact your supervisor, another leader, a colleague, or the care unit for your campus, whoever you can reach, for help in deciding how to proceed. Tell them the things that seem concerning and problem solve together. If you assess a situation as a serious and imminent threat to someone's immediate health, safety, or well-being, your role is to prevent harm by seeking emergency services. Let's imagine a scenario. As an instructor, advisor, or supervisor, you email a student you've not communicated with lately, and they respond saying, "Sorry for not responding. I feel hopeless and I wish I could disappear. I can't go on. No need to reply to me as I won't be available after tonight." A message like this may indicate they are planning to attempt suicide. Now, how to contact emergency services in order to prevent harm. In the U.S., we seek emergency services by contacting 911. Police will likely be dispatched as they're often the emergency service responsible for intervening in crises. Campus counseling services, health clinics, care teams, etc. are not emergency services. They typically work daytime office hours only and are frequently engaged in appointments and meetings. Therefore, to get emergency services, you contact 911. When calling 911, you'll want to briefly describe the safety concerns and provide any information about the student's location and contact information. For example, you might say, The student said they want to end their life and won't be available after tonight. If your concern is about suicidality, you can request a welfare check. A welfare check is when police go visit a person to see how they're doing and if they need emergency care. When calling, be clear about any weapons mentioned or if the student described methods of causing harm. For example, when I asked how they want to hurt the person they're angry with, they said they have a firearm. That information helps dispatch and responders assess the situation. Before hanging up, you'll likely be asked for your name and contact information in case they need to follow up. Some members of our community are hesitant to activate or engage with police. If you are, or if you anticipate that a student, based on cultural identity or other reasons, might be reluctant to engage with police, think through how you will handle mental health crises now. The university expects you to contact 911 so that police, emergency medical technicians, and/or other mobile crisis response units are activated. Our campus police are trained in mental health de-escalation techniques and respond to mental health crises regularly. However, the unit which responds to a situation is beyond your control. That decision is the responsibility of 911 emergency dispatchers. They will try to determine where the student is currently located and send the unit for that area. Some counties have mobile mental health units that respond to crises instead of or with police. If you're curious if that exists in your area, research it by doing an internet search using the terms Mobile Crisis Unit and the county of interest. It may be helpful to know what will happen after you alert emergency services. When emergency responders visit with a person of concern, their job is to further assess the situation, and if someone is in imminent danger, to prevent harm, often by getting them to a hospital emergency room for mental health care. To better understand this process, watch the next video, which was produced by our Department of Public Safety. Activating emergency services may feel unsettling, but know that staff in our counseling services, health clinics, and residence halls make these calls somewhat often. It's your way of showing deep care and concern for students and our community. We hope this video has helped you anticipate how to respond to a mental health crisis. We hope that anticipating your reactions now makes it easier for you to take action in the moment. We are all in the role of supporting student mental health and wellness together. Thank you for taking time to prepare yourself to respond to a student mental health crisis.